Hi, I am very happy to meet you all once again. Today, I am going to present a new topic called Posology. You know, Posology is an important division of pharmacology that deals with the dose or quantity of drugs that can be administered to a patient to get the desired pharmacological actions. Under homeopathic principles, any potency may be required in any case. The selection of the dose is as much an integral part of the process of making a homeopathic prescription as the selection of the remedy, and often a quite as important. A well-selected remedy may fail utterly or even do injury because of the wrong dosage. The homeopathic doctrine of dosage is based upon the discovery of the opposite action of large and small doses of medicine. It is another application of the third Newtonian law of motion. Action and reactions are equal and opposite. For example, that ipecac in large doses causes nausea and vomiting, and in small doses under certain conditions will cure the same condition. That opium in large doses will cause a deep sleep or narcosis. A red in small doses under certain conditions will cure the same. Now, let us see the etymology of posology. The term posology is originated from the Greek language. The word posos meaning how much and the word logos meaning study or discourse. See, posology is a branch of medical science which deals with the dose or quantity of drugs that can be administered to a patient to get the desired pharmacological action. Now, let's see the definition of homeopathic posology. A homeopathic dose means the particular preparation of medicine used, the quantity and form of that preparation, as well as the number of administration of the medicine. In short, homeopathic dose include potency, quantity, form, and number of administration of medicine. The study of doctrine of these doses is known as posology. Now let us see the difference between the homeopathic and allopathic concept of doses. A dose is a specific quantity of a therapeutic agent to be administered in a given instance, such as a drug or a medicine that is measured to be taken at one time. In allopathic, dose means so many drops by measures or so many grains by weight that enough to produce the direct positive or physiological effect and not enough to endanger the patient. Allopath relates the word dose to the material quantity of the medicine. In homeopathy, the proper dose is always the least possible dose, that is, the infinitesimal dose which is sufficient for a cure. The homeopathic dose is related to the particular preparation of medicine, the quantity of that preparation, and the form of that preparation, and the number of administration of the medicines or its repetition. Now, let us see about the selection of potency. Under homeopathic principles, any potency may be required in any cases. It is as unreasonable to expect to cure all cases with any 2 or 3 potencies as it is to expect to cure all cases with any 2 or 3 remedies. In either cases, who follow such a course are governed more by the love of ease and their prejudice than they are by their desire for efficiency. The great scholar Henry N. Guernsey compared the series of potencies have been to the gamut in music. A skillful artist may indeed construct a harmony with the various vibrations of the same chord, but what a more beautiful and perfect harmony might he construct by a proper combination of all the sounds that can be elicited from his instruments. In general, it may be stated that any curable disease may be cured by any potency and indicated remedy is administered. But the cure may be much accelerated by selecting the potency or dose appropriate to the individual case. Assuming that there is a difference in action of the various doses of medicine and that the series of potencies or preparations of the different medicines have been available for the use, it follows that the entire series should be open to every practitioner and that each man should be competent, willing and ready to use any potency or preparation of the remedy indicated in a given case without prejudice. If he confused himself to one or two potencies, be they low, medium or high, he is limiting his usefulness and depriving his patients of a valuable means of a relief and cure. 5 different considerations influence the choice of the dose. One is the susceptibility of the patient, and second one is the seat of the disease, and third, the nature and the intensity of the disease, and fourth, the state and duration of the disease, and the fifth, the previous treatment of the disease. Now, let us see about the susceptibility of the patient. Generally, susceptibility is the most important guide in the selection of the dose. Susceptibility varies in different individuals according to age, constitution and temperament, habit and environment, and the character of disease. The susceptibility of an individual to a remedy at different times also varies. Idiosyncrasy may exist as a modifying factor. Homeopathy must always be considered. The most similar the remedy, the more clearly and positively the symptoms of the patient take on the peculiar and the characteristic form of the remedy, the greater the susceptibility to that remedy and the higher the potency required. The susceptibility is modified by the age. Generally speaking, susceptibility is greatest in children and young, vigorous persons and diminishes with the age. Children particularly sensitive during development and the most sensitive organs are those which are being developed. Therefore, the medicines which have a peculiar affinity for those organs should be given in the medium or higher potencies. The susceptibility is modified by the constitution and temperament. The higher potencies are best adapted to the sensitive persons of the nervous, sanguine, or the choleric temperament, the intelligent intellectual persons, quick to act and react type of persons, and the zealous and impulsive persons. The lower potencies and the larger doses and more frequent doses correspond better to individuals like torpid and phlegmatic individuals who have dull of comprehension and slow to act, who have coarse fibered and sluggish individual of gross habits, those who possess great muscular power but who require a powerful stimulus to excite them. Persons can take with seeming impunity large amounts of stimulants like whiskey and show a little effort from it. When ill, they often require low potencies or even sometimes material doses. The susceptibility is modified by habit and environment. Diseases characterized by increased vital action respond better to higher potencies. The higher potencies are best adapted to individual like while he is doing intellectual occupation, who have excitement of the imagination and emotions, individual leading sedentary occupations who are used to sleep long hours, a man having characteristic regarded as typical of a woman. Generally speaking, diseases characterized by diminished vital action require lower potencies. Lower potencies are best adapted to people who are accustomed to long and severe labor out of doors, who sleep little, whose food is scarce, person exposed to the continual influences of drugs such as tobacco workers and dealers, distillers and brewers, and all connected with the liquor and tobacco trade. Druggists, perfumers, chemical workers, etc., but where the illness is directly caused by some particular drug influences, a high potencies of the same or a similar drug may be the best antidote. Lower potencies are also best adapted to idiots, imbeciles, and deaf and dumb persons. Certain malignant and rapidly fatal diseases like cholera may require material doses or low potencies of the indicated drug. Later, after the reaction has been established and other remedies corresponding to the symptoms of later stage of the disease come into view, higher potencies are required. The susceptibility is modified by character of disease. In certain terminal conditions, due to the existence of gross pathological lesions or a long existent exhausting chronic diseases and much previous treatment, the power of the organism to react even to the indicated homeopathic remedy may become so low that only material dose can arouse it. Here, dynamic medicines will not act. The disease reaches the stage of organic pathology. A massive dose of crude medicine is to be administered in these cases. An example of this is seen in certain terminal conditions of valvular heart diseases, where digitalis is indicated remedy, but no effect is produced by any potency. The patients will respond, however, to tangible dose of pure tincture or a fresh infusion of digitalis and sometimes make a good recovery from a condition that seem hopeless. In terminal conditions, therefore, when the patient does not react to the well-selected remedy, nor intercurrent reaction remedies are given in the potentized form and small doses, resort the crude drug and increases the dose to the point of reaction. When reasonably sure of the remedy, give the tincture or lower triturations, first in moderate, then in increasing dose until the dosage is found to which the patients will react. Now let us see the seat of disease, character and intensity of the disease have some bearing upon the questions of the dose. Certain malignant and rapidly fatal diseases like cholera may require material doses or low potencies of the indicated drug. Hahnemann's famous prescriptions of camphor in drop dose of the strong tincture given every 5 or 10 minutes, with which so many thousands of lives have been saved, is an illustration. Later, after the reaction has been established and other remedies corresponding to the symptoms of later stage of the disease come into view, higher potencies are required. Now, let us see the selection of potency related to the nature and intensity of the disease. In functional diseases, the symptoms are subjective or physiological, where the vital force is tactile. In such case, higher potencies are responded well, and at the same time in the organic conditions, lower potencies responding well. In acute diseases, susceptibility generally remain high because no organic change is usually affected in such cases, and if it occurs, it is temporary. In acute crisis and chronic trouble, medium or lower potencies are to be given. In chronic diseases with no organic change, it is safe rule to begin with the 200 centesimal potency unless this is dangerous because of nature of the remedy, the degree of the pathology or the depth of the miasm. In chronic diseases with organic change, lower preparations should be used. In mental diseases, higher potencies should be used. Now, let us see the selection of potency related to the stage and duration of the disease. In incurable chronic diseases, lower and medium potencies should be used. In the terminal stage of chronic diseases, very high potencies should be used. Now, let us see the selection of the potency related to the previous treatment of the disease. Patients who have taken many crude forms of allopathic or homeopathic drugs often require higher potencies for their use. Now, come to various kinds of doses. There are different doses are there. First, let us see about the maximum dose. It is the maximum or the largest possible amount of medicine which can be taken at a time by an adult, not harmful to human life. Now come to the lethal or the fatal dose. It is also known as toxicological or narcotic dose. It is such an amount of dose which can cause the death of the living being. The fatal dose of different substances may be different, which depend upon their toxicity. Minimal lethal dose is the smallest dose that has been recorded as fatal to a healthy person. Now come to the booster dose. Booster dose is a subsequent dose given to enhance the action of the initial dose. The fractional or the refractive or divided dose. It is the refraction of a small dose that is to be taken at a shorter intervals. The physiological dose means the dose of a drug empirically selected of a sufficient quantity and strength to produce definite predetermined effect on a group of symptoms. Practically, it amounts to the maximum dose consistent with safety. A physiological dose of atropine or belladonna, for example, is sufficient to produce dilatation of the pupils, dryness of the mucous membrane, and flushing of the skin. The action of the drug is carried to this point irrespective of any accessory symptoms that may be produced, or as to whether it is curative or otherwise. Physiological dose are those which stimulate the normal physiology or the functions of the different organs or systems of our body, and hence the symptoms thus appearing are known as physiological symptoms. Now come to the minimum dose. It is that dose that is sufficient to overpower and annihilate the disease and capable of producing slight homeopathic aggravation, scarcely observable after its ingestion. It is that amount of medicine which is the smallest in quantity produces the least possible excitation of the vital force and yet sufficient to effect the necessary changes in it. The minimum dose is a dose so small that it is not capable of producing symptoms when used therapeutically. Homeopathy requires that the therapeutic dose must be capable only of producing a slight temporary aggravation or insufficient of already existing symptoms, never producing new symptoms. Only a similar remedy in the smallest possible dose is capable of bringing about this highly desirable result. Now, let us see about the repetition of the medicine. There are Hahnemann's instructions of repetition of doses available in the 5th edition of Organon. In the repetition of doses, certain factors should be considered like condition and progress of the patient, nature of the disease, nature of the remedy. Now let us see the condition and progress of the patient. It is perceptible and continued progress of improvement. Repetition is contraindicated. The perceptible and continued progress of improvement in acute or chronic diseases contraindicate the repetition of any medicine because the beneficial effect which the medicines continues to exert is rapidly approaching its perfection. Under these circumstances, every new doses of any medicine, even of the last one that provide beneficial, would disturb the process of recovery. Repeat the dose only when improvement ceases. To allow a dose or remedy to act as long as the improvement produced by it is sustained is a good practice. But to attempt to fix arbitrary limits to the action of the medicine, as some have done, is contrary to experience. Repetition may be continued till either recovery ensure or different group of symptoms arises and thus demands different remedy. The dose of same medicines may be repeated several times if necessary until recovery ensues or until the same medicine ceases to do well. At that period, rest of the diseases presenting a different group of symptoms demands another homeopathic remedy. Now, let us see the nature of the disease. In chronic diseases, the medicines may be repeated at intervals of 14, 12, 10, 8 or 7 days. In the case of chronic diseases, assuming an act form at still shorter intervals. Now come to the nature of the remedy. The higher potencies are not frequently repeated. The short-acting remedies are repeated at shorter intervals. The deep-acting remedies are less frequently repeated. Some medicines are having alternative actions like ignatia, also bryonia, and sometimes belladonna. These medicines have the power of alternating. Man's health consists of chiefly in alternating action. It is a kind of primary action. Symptoms are in part opposed to each other. If after prescribing one of these remedies on strict homeopathic principles, no improvements follows, and this will soon be obtained by repeating a fresh and equally small dose of the same medicine. These are instructions regarding the repetition of dose in the 6th edition of Organon. The repetition of dose in 50 millismol potencies mainly depends upon the nature of the disease. In long-lasting diseases, repeat the dose daily or every second day. In acute diseases, repeat the dose every 2 to 6 hours. In very urgent cases, repeat the dose every hour or oftener. In case of chronic diseases, repeat the dose of every correctly chosen homeopathic remedies, even whose action is a long duration, may be repeated for months. Dr. J.T. Kent has given clear instructions about the rules of repetition in the second prescription. As per Dr. J.T. Kent, the first medicine should be repeated when the improvement remains standstill and when the original symptoms return after a temporary disappearance. The indications of repetition of the same medicines is when the original symptoms return after a temporary disappearance. When improvement symptoms returns after remain standstill, if no outward symptoms have appeared during this waiting period, repetition of the previous medicines may help to complete the cure. That's all about homeopathic posology. The approximate list of dose of homeopathic pharmacy is given in the description. Thank you for watching. See you in the next session. Bye.
Thanks for watching.
Like,
Comments
share,
and
subscribe.